Hi, everyone. I'm Jeralise Diaz with the Record Journal. We're here with our new weekly segment, Ask the Expert, in partnership with Hartford Healthcare's Midstate Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health. We'll talk about various aspects of the vaccine rollout and have a medical expert answer a weekly question. Today, I'm joined by Dr. Sarah Banks, infectious disease health specialist for Hartford Healthcare's Central Region. This week's question is, how were the COVID-19 vaccines developed so quickly compared to other vaccines?
Thank you for that introduction. That's a great question because we do know, and I've heard from a lot of patients, how rapidly these vaccines have been rolled out over the past year during this pandemic. I think it's really important to understand that the mRNA technology that these vaccines are based on is a technology that's actually been around for a few years, and the scientific community has been working with this platform over the past several years with regard to other viruses in an attempt to make a vaccine that would be helpful against many different viruses, including rabies and Zika. So that technology was already out there before the beginning of the COVID-19 pandemic. And so that was a very important stepping stone that was already in place for vaccine development for COVID-19. Now, apart from that, because of the global issue that this pandemic has led us into with such drastic changes in our lives and the health and well-being of many of the communities around us, many of the world's leading scientists and experts have gotten together and focused their expertise on just this one problem. So even though they've been working over a shorter period of time, they've put all of their efforts into this one problem, and that has resulted in the solution for, I think, our way out of this pandemic, which is our vaccines, which have now been rolled out to, I think, the general population and are becoming more widely available to all age groups across the state.
Thank you, Dr. Sarah Banks, for joining us today, and thank you all for watching. Tune in next week for our next Ask the Expert. If you have a question you would like answered, leave it in the comments below and we'll add it to our list. Thank you again to our partners for making this possible: Hartford Healthcare's Midstate Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health.